A national model is being implemented at NCSS that includes all three service divisions, behavioral health, children's and developmental services, plus administration, as well as clients that receive services to increase the capacity of the organization to provide trauma-informed care. Over 120 organizations nationally have participated in this program, which leads to safer environments, addressing staff self-care, providing trauma-sensitive services, and avoiding re-traumatization of those that we serve. To discuss the Trauma-Informed Care Initiative in greater detail, I'm pleased to introduce this month's guests, and they are Julie Parker, Outpatient Crisis and Integrated Health Services Program Manager in the Behavioral Health Services Division, Samantha Thomas, who's Children's Initial Response Team Leader in the Children, Youth, and Family Services Division, and Scott LaValle, Team Leader of the Behavioral Support Team in the Developmental Services Division. I want to welcome all of you to the show this month.
Thank you, Stuart.
Now, to begin with, let's start with what is trauma?
Sure. So I could start there. Trauma is described as something that's painful or emotionally distressing that happens to someone. It could happen, there could be one traumatic event, there could be multiple traumatic events in someone's life. Typically, it makes someone feel powerless. The situation might be brought upon them. Might be something like a car accident. It could be something such as childhood neglect. It could be war. It could be terrorism. There's a whole gamut of traumatic events. It could be something like bullying, which sometimes people don't view as trauma, but in fact it is trauma. And certainly what might be something traumatic to you might not be traumatic to me, and we'll talk about that as we go on today. Trauma really overwhelms someone's ability to cope. And the event is very difficult, and it impacts someone's daily living. It could impact their work. It could impact their relationships with others. So it's a very distressing event that could involve loss, but in general, it's something that's very distressing and emotionally overwhelming for someone.
Mm-hmm. And when was NCSS selected by the National Council for Behavioral Health to participate in this trauma-informed care model, which again will increase the organization's capacity to address effects of trauma?
Sure. So in 2013-14, the National Council of Behavioral Health put out a application for agencies across the United States to fill out and see who would want to be part of this collaborative, and we filled the application out and sent in some information about our agency, and we were chosen in 2014 to be a part of this model. We are one out of 60 organizations across the United States that was chosen, and as you mentioned, the team that we have made up at Northwestern Counseling Services is made up of various people across the service divisions, and also I think something that's unique is we've also made sure administration is part of our model, and we have folks from reception that are part of our committee as well, which we feel is really important.
And as an aside, are we the only organization in Vermont that has been chosen for this?
Yes, we are. Yeah.
Okay.
The closest one, I believe, is an agency in New York that was chosen as well.
Mm-hmm. Mm-hmm. Okay. And what is NCSS's trauma-informed care vision statement?
Sure. One of the things that we had to do is come up with a vision statement for our organization. And so it starts off with providing a calm and secure environment for both of our staff and our clients. We want everyone to feel like they have a voice in their own recovery. That's one of our imperative things. We want our staff to understand and respect that there is a whole range of traumatic events, and again, how people cope and how people interpret what is traumatic to them. And so we want staff to understand that. We want to deliver services that show that we are a trusting organization, we're a trusting staff, that we're respectful, we believe in people healing, and we are hopeful for people healing after a traumatic event. Mm-hmm. So that's our vision statement.
Okay. And let's talk a little bit about what some of the statistics are that are relative to the number of people that actually are affected by trauma.
Sure. It's pretty staggering, actually. So the National Health Council did various surveys and studies about trauma in different groups of folks. So one study, for example, clients that were served at public mental health centers, 90% of those folks indicated that they had had some type of trauma. So that means for every 1,000 people we serve, it's 900 people that would indicate that they have trauma. So we think that's a pretty staggering number. 80% of people in psychiatric hospitals would say that they had some type of trauma in their life. And again, I think that's another staggering number. That's a very high number. 66% of people that are in substance abuse treatment would identify having some trauma in their life, specifically childhood neglect. And 64% of people who, in this study, who attempted suicide also identified as having significant traumatic events and childhood neglect. And typically, you know, when we talk about traumatic events, we talk about it, we think it's outside of the norm that a traumatic event happens. And I think what we've come to know in this work that we're doing is that traumatic events in folks' lives, at least one, is becoming the norm, and not to mention more than one. So it's pretty significant, pretty staggering, the number and percentage of trauma in the folks that we serve, and nationally of folks that are dealing with a traumatic event.
And I think with something you said there, Julie, which is, first of all, how high the percentages are, but what trauma is to one person is not to another,
Yes.
which I would say falls very much in line with, from a clinical standpoint, every individual that you serve is on a different plan because everybody's circumstances are different.
That's right.
So this falls in line with that.
Yep.
As to, has somebody experienced a traumatic event or numerous ones, or
Yes, absolutely.
and is that something that perhaps, do you think it gets, I don't want to say overlooked, but I guess I don't know another word to use than that trauma from someone's life, possibly in the past, could have been overlooked
Yes.
if the right set of questions aren't being asked or discussed.
Absolutely, and it's something that we talk a lot about, and one of you know, part of this collaborative that we're in is assessment. When a client comes in and we do an assessment on a client, are we asking enough questions to identify trauma? Are we asking enough things to help us understand what got them to this point? And one of the key things that we talk about is not to say to a client, what's wrong with you, but instead we ask, what happened to you? And I think that's really important in the way we phrase things, and also to help us identify what's happened that's brought you here, that's given you some struggles. And just like you mentioned, and I said earlier, I think you know, someone could have a break of a relationship, and I could be fine with that, and my coping could be fine, and I could, you know, use my friends for support and continue on. And with someone else, that could be very devastating, and it could impact their coping and make them feel unable to cope.
Sure.
Yeah. So,